The first one we looked at was a more psychosocial, and this would be a pathophysiological condition. So it reads as follows. The nurse is caring for a patient with cirrhosis of the liver. Which assessment will the nurse perform to determine if the condition progressed to hepatic encephalopathy? So the first thing we're going to look at is what the question is really asking. So we have a patient with cirrhosis of the liver, but we also want to determine if the condition has progressed to hepatic encephalopathy. So the question is really asking us is which assessment findings reflect hepatic encephalopathy. So our key words are assessment and hepatic encephalopathy. So that's what we're going to focus on. This has nothing to do with cirrhosis of the liver. So again, I want to make sure that you guys understand that you will not be able to answer these questions unless you have your core content and core knowledge under your belt. So let's go. The first answer choice says, ask the client if they know the current date. For this question, we're going to use the why strategy. And I know I said that you never ask the patient why, but you can always ask yourself why. For the first answer choice, it says, ask the client if they know the current date. Now what we're going to do is instead of treating each answer as a true or false, we're going to ask ourselves why. Why are we asking if they know the current date? Going back to the condition is hepatic encephalopathy. What do we know about hepatic encephalopathy? Well, one thing you should know about hepatic encephalopathy is that mental status changes and mental alertness changes as well, and patients become very lethargic and sleepy. So asking the client if they know the date would be an assessment of mental status, maybe, right? So we're going to keep that answer choice as an option. Again, it's select all that apply. We don't want to rush. We're just going to keep it as an answer choice. So we're going to put a circle beside it. The second option says, ask the client to extend the arms. Why would we be asking the client to extend the arms? If the patient is exhibiting hepatic encephalopathy, you know that another characteristic would be astrexis of the hands. And astrexis of the hands is a fluttering movement of the palms when the client extends their hands. So we're going to keep that as an answer choice. So we're going to put a circle beside it. Again, this is very pathophysiological, and you have to know the condition in order to be able to answer the questions. The third answer choice is review lipase and amylase levels. Now, even if you don't know anything about hepatic encephalopathy and you just know that something has to do with the liver, you would know right away that reviewing lipase and amylase would not be an optimal answer because lipase and amylase are digestive enzymes that come from the pancreas. They come from the pancreas. And so we won't be really assessing for any hepatic pathophysiologies. So if you know that you're answering a liver question and you get lipase and amylase, you would know that lipase and amylase is are pancreatic enzymes and have nothing to do with the liver at this point in time. So we're going to eliminate this as an answer choice. The fourth answer choice says determine if jaundice is present. Now that's a pretty good one. Why won't we determine if jaundice is present? I mean, we're answering a hepatic question. There's a hepatic problem, and we know that, maybe perhaps there's going to be some jaundice if the liver's not working, right? However, if you know your, again, pathophysiology about hepatic encephalopathy, you know that jaundice is not part of hepatic encephalopathy, but it is part of, and maybe, cirrhosis of the liver. And that's where they're going to try and trick you, because you have a patient with cirrhosis of the liver, so we're going to check if they have jaundice. However, the question is not asking anything about cirrhosis of the liver. It is asking about hepatic encephalopathy. So we're going to eliminate this answer choice. The last answer choice says assess for spider nevi. And spider nevi are little vessels or veins or capillaries. So I don't know, that's my drawing of an arm. Sorry, everybody. And they're kind of like, they kind of go like this, and they look like spiders. So it's a cluster of really tiny blood vessels. We read about the liver, and we know that something like that happens with the liver. Again, you're right. Something like that does happen with the liver. However, it happens with, you guessed it, cirrhosis of the liver. So it's a characteristic of cirrhosis of the liver and has nothing to do with hepatic encephalopathy. We're going to eliminate this answer choice. It has nothing to do with hepatic encephalopathy. So we're going to eliminate that answer choices, and we have left with ask the client if they know the current date. So we're going to assess level of consciousness, and we're going to assess mental status. And the second one says ask the client to extend the arms. So we're going to assess for a condition called astrexis, which is directly related to hepatic encephalopathy.